Hello, my name is Jody Longnecker, and I completed my senior seminar research on the opioid epidemic in both the United States of America and Ukraine. Over the past 2 decades, as the prevalence of chronic pain and healthcare costs have exploded, an opioid epidemic with adverse consequences has escalated. Overdoses leading to death and addiction are some of the consequences that the opioid epidemic are causing. For this research, I focused on gaining my information from scholarly journals, from professionals in their fields, as well as studies done on the opioid epidemic. I chose to focus on 2 countries, the United States of America and Ukraine. I felt as though both of these countries were different yet very similar when it comes to both countries currently dealing with an opioid epidemic. Aside from the opioid epidemic, there is a sense of identity that is an issue and needs to be looked at. Identity is a core reason as to why people are addicts or cannot come clean with their addiction, because they are afraid of how others might perceive them in society. Another issue with the opioid epidemic comes the morality standpoint. What is ethically correct and not correct to do as a citizen? America handles the opioid crisis differently than Ukraine because there is a great difference in their insurances due to Ukraine having a guarantee that all medical treatment will be free, while the United States of America has different insurance plans that do not always cover medical needs or ones related to drug use. Because of this, people are dying of overdoses more in the United States than any other country in the world because they do not receive the proper treatment or it is not affordable. Along with receiving the proper treatment, many people struggle with their own identity because the addict themselves could feel shame when they are an addict, and even more apprehensive of how others might view them. The first country I focused on was the United States of America. The sad truth in our society is that almost everyone in America today has either heard of the opioid epidemic or have experienced a loss or addiction of a loved one to this crisis. The United States is grappling with one of the worst ever drug crises. America has about 4% of the world's population, but about 27% of the world's drug overdose deaths. A study done showed that more than 800 people a week die from a opioid-related overdose, and millions of other Americans are suffering from an opioid addiction. The country we are so proud to call our home, the United States of America, is also home to the highest drug death rate in the world. The second country I focused on was Ukraine. Following the dissolution of the Soviet Union, political upheaval in Ukraine resulted in poor socioeconomic condition that health disparities, thereby fueling an explosive HIV and opioid epidemic. Numerous studies have drawn attention to the risky way in which people obtain illicit opioids in Ukraine. Sometimes, the liquid poppy straw is bought in pre-loaded syringes, from dealers who often inject themselves, or from dealers who allow users to extract it from jars directly into their own syringes, so that in a single day, many recycled needles and syringes can be used to extract the liquid from one vessel thus increasing the risk of transmitting infections such as hepatitis, viruses, and HIV. The Ukraine, though, does do a good job with their treatment because since all medical costs are covered by the government and everything is free, many people who are dealing with addiction are able to get the help that they need without having to pay a lot of money like the United States people do. Who defines our identity? Do we individually define our identity, or is there a culture and social influence? Identity is a huge concept when it comes to opiate dependency and addiction because if an addict has no support from society, it is then hard to be able to identify themselves with anything other than the label a drug addict. The label society puts on people addicted to drugs is not who the people are. An addiction is not a person. It might be part of a person's lives, but addictions and other labels do not define someone. There are so many derogatory name callings when it comes to people with drug addictions. Many people use the terms crackhead, junkie, druggie, pillhead, dopey, needle pricker, meth face, low life, as ways of describing a person with a drug addiction. And in our society, this is acceptable, but should not be. There needs to be a sense of compassion. And I am not exactly saying that we as a community need to be accepting of drug addicts per se, but I think if we are more understanding and willing to help and support drug addicts themselves, the drug addicts would be more comfortable and feel a part of society during their road to recovery. Judging someone right off the back and even expressing all the negatory comments one might have about another human, drug addict or not, can be hurtful. And some addicts might feel as though they are not part of society. Treatment is important because it could save a life. In my own opinion, I think treatment should be less expensive in the United States, or insurance should cover drug treatment costs, because I do not feel as though someone should be limited to the amount of treatment they get because of their insurance if they are trying to help themselves recover and beat their addiction. The United States and Ukraine are both important countries to discuss when talking about the opioid epidemic. Both countries are dealing with this crisis as we speak. And as we can see from research, both countries dealing with the same situation are handling the situation different. For example, the United States has high treatment costs and a lot more overdoses, while Ukraine has free insurance and treatment cover costs and lower overdose rates. More comes with the opioid epidemic than mentioned. HIV is a huge concern on its own, but even more when discussing the opioid epidemic, because there is a lot of needle sharing and this increases the HIV rate among addicts and spreads to non-addicts. Identity is also very important with the opioid epidemic because many addicts do not feel comfortable coming clean about their addiction because of the names they will be called, and they are afraid of how loved ones and the public might view them. Imagine having a close family member who is addicted to an opioid. Is it your civil duty to get them help? Would you do whatever it takes to get them help? How can we as a society help the opioid epidemic? Thank you for listening to my presentation.